how would I describe what cytokine is to a patient? So I would describe it like when you sprain your ankle. So if you sprain your ankle, all of a sudden it blows up like a balloon. It's very painful, but the pain actually isn't in the sprain of the ankle. The pain is the inflammation. It's the swelling around the ankle that's causing so much pain. And that's why we reach for a bag of frozen peas. Now, I'm not saying a bag of frozen peas will work on applying it to your dry eye disease, but it's in essence by reducing inflammation, that's what's protecting or providing patients with that comfort.
What I found works very well, using a similar analogy to that of a dentist or a hygienist, a dental hygienist. The hygienist or the dentist would explain a way to prevent gum disease, and that would be to clean away the plaque that patients would have build up on their teeth and around their gums, and to prevent gum disease the hygienist would recommend that they remove that from the gum and the teeth area. So similar to that, an optician would recommend to a patient that they have their lashes and their lids cleaned professionally, and they would recommend the ZEST procedure to clean away the biofilm, the bacteria, the blepharitis, and something called Demodex mites away from the lash and lid margin, and that would prevent patients experiencing long-term discomfort.
It should be a first line of defense for any dry eye patient. Main reason is it's the best possible treatment on your shelf. It's going to last the longest, it's going to provide the instantaneous relief and be very substantial relief at that. So why would you offer anything else? And I also think you have to ask two other questions, and that would be, have they tried OTC over-the-counter products before, and were they compliant enough to see the effects that they wanted in terms of relief? I'd say 50% of the time they didn't see the relief that they wanted. So this is a great way for the clinician to do it for them in practice, or 80% of the job, and then let them continue that treatment at home with, say, just a couple of bits of aftercare instead of a whole regime.
I think this actually reverts back to Barry's point around the hygienist about, an example I've used multiple times is when was the last time you go to a hygienist and then stop brushing your teeth? We're not saying to stop brushing your teeth. We're just going to provide this deep in practice cleanse like the hygienist. Your at home maintenance, your brushing of the teeth still applies. It's just we've just done a much deeper, or given it a much healthier kickstart into the process is how I've always described it.
All patients would benefit from ZEST. As a clinician, I would recommend to the patient that after reviewing their dry eye questionnaire, if they haven't completed the dry eye questionnaire, as a clinician, I would say after hearing you describe your symptoms along with your eye examination, I would recommend an effective in-practice treatment called ZEST, which will gently dissolve any bacteria or biofilm inflammation, just to sort of deal with some of the symptoms that they're experiencing, and this would reset their whole comfort level, or start to produce their more natural oils for their tears.
I always start the conversation with "I recommend ZEST because." It's very simple. It's very easy to remember. And it was actually Francesca Marchetti who taught me this. So she uses it in clinics. Very good. So I recommend ZEST because, and then go into explain why that patient needs this procedure. So it could be they've got blepharitis and explain what blepharitis is, or they've got meibomian gland dysfunction, or they've got a Demodex infestation, etc., etc. And it's just a quick overview of what that might be. And always then explain, so this is why you're experiencing these symptoms, and then reiterating the symptoms that they've said, whether that be in a DEQ5 or just in general conversation. So, for example, it would be, I recommend ZEST because you have a condition called blepharitis, and that's what's causing, this flaking of the lids and lashes. And I recommend ZEST to actually, what we say is we don't say debride, we say exfoliate, because patients don't understand what debridement is, but they do understand exfoliation. So This ZEST procedure is like a deep cleansing exfoliant. It's going to really cleanse the base of those that lid margin and those eyelashes, get rid of a lot of this buildup, and provide a lot of relief to those dry eye symptoms that you've been referring to. I always close with, I have time in my clinic right now, or I can book you in with a colleague at a later date. What say, would you like this procedure, yes or no? The reason why is no shouldn't really be an option in terms of managing dry eye disease. We know it's a disease, we know it's a progressive disease, and if we don't interfere or intervene, it will get worse. So I believe clinically we have a duty of care to perform that management there and then. So I would be saying book you in now, or I could book you in later. I would never be saying yes or no.